It's turning into an unwelcome holiday tradition. COVID cases on the rise yet again in many parts of the country.
We already have a very stretched healthcare system, and this adds another stress to an already stretched healthcare system.
The biggest hotspot, Ontario, where wastewater testing data now suggests cases have doubled from the same time last year. And in cities like Guelph, cases have hit a 2-year peak. But doctors believe that for most Canadians, those numbers shouldn't be too concerning.
If you're young and healthy, there really is little to worry about from a COVID perspective.
That's ICU Dr. Kwadwo Karamentang. He's treated COVID patients since the start of the pandemic and believes we're in a new COVID era.
I do think this is a time where this is the time to be connected, to have those Christmas parties, to connect with your staff, to be with family.
For family members you may see who are elderly or immunocompromised, the same old advice applies. Mask up, stay home when you're sick, and keep up to date on vaccinations, but not just for COVID. Shots for RSV and influenza can also help stop serious illness.
I'm just as concerned about the upcoming influenza season for my pediatric population and the ongoing RSV season as I am about COVID-19. And I think that's true for most adults as well.
The triple threat isn't expected to overwhelm hospitals in Ontario, but in Quebec, the health minister is warning ERs could be full of sick patients with limited staff due to public sector strikes.
This is going to be tough. It's going to be tough for the same reason, the combination of viruses and everything.
Doctors' advice to stay up to date on COVID vaccinations seems to be falling on deaf ears, with less than 20% of Canadians 70 or older fully boosted.